And we
Hello
are live.
everyone, welcome back to another stream. Today I'm going to be trying to do as many of these Anki cards as I possibly can before midnight or 1 a.m. We'll see how I feel. I think it was on Monday night I was dead. Or was it last night? I honestly can't remember anymore.
Yeah.
But one of these previous nights I was just at a loss for Anki. I was probably getting like 20% retention. So I've loaded up a lot more cards in the home stretch for exams, and let's try to get these out of the way. And then tomorrow we can finish content.
Beautiful.
So I'm going to get started.
All right.
Okay, I'm going to try to articulate myself as I go.
Sounds good. Go take a shower.
That's all good. I'll see you soon. So the pharyngotympanic tube opens via swallowing, and it's mediated via V3. But I will be honest, I don't know the name of the exact nerve. I think it is the tensor tympani, but I could be completely wrong. Tensor veli palatini. Okay, tensor veal palatini. Yeah, like this nerve only appears once throughout the entire syllabus, so I'm not entirely sure if we do need to know it, but why not, I suppose. The middle ear, this could refer to a number of things. I'm just going to quickly just do like that. Okay, so contains. I probably should have like contains, so I know at least the idea, but fair enough. Contains the tympanic cavity, auditory ossicles, mastoid air cells, and the pharyngotympanic tube. This is a melanocyte. Excellent. This could again be anything. I'm still getting used to like these new cards in the sense of the layout. So tensor tympani and stapedius regulate ossicle movement, dampen loud sounds. So when I see that again, hopefully I will know that. A calculus causes uteric spasm and increased intraliminal pressure. I'm pretty sure this next one's referring to the visceral pain, and that is T11 to L1, I believe, and that's linked to groin pain. Great. Here we have nerve. So the trigeminal comes from the pons. Great. Anterior fontanelle is diamond-shaped, and it's the largest fontanelle. Future side of the bregma, 18 months. So that's pretty good, that one. The neck and handle lie on the, I believe it's just the tympanic membrane, and it's excellent. The carotid sinus is a dilatation in the proximal part of the internal carotid artery. Excellent. Clinical significance. Yeah, like watershed areas can overlie multiple lymph drainage areas. I think that's what this is referring to. So it's specifically talking about watershed, so we'll talk about that soon. So the orbital, that's going to be the frontal plate. I always forget this. I always get this mixed up. So this is referring to the orbit. So if I'm thinking up here, like the superior roof of my orbit, I'm going to say that's probably the orbital plate of the frontal bone. Great. The trachea extends from C6 to T4, where it bifurcates at the cardina. Excellent. And the cardina is obviously at the sternal angle. What elevates the first and second ribs? That is my scalenes. Excellent. Epidermis is comprised of stratified squamous epithelium, and we know it's in the 5 layers. So stratum corneum, lucidium, granulosum, spinosum, and basal. And there's rapid division in the basal layer, and it becomes increasingly shunted towards the surface. The jugular foramen is going to contain nerves 9, 10, 11, and the internal carotid artery. Sorry, not internal carotid artery, internal jugular vein. It literally has it in the jugular. So that's a bit of a slip up. I'm going to be harsh on myself tonight. Then we have the epiploic appendages. So actually the hostra are the things that we can actually see on x-rays. I'm pretty sure that's a common exam question. We have the epiploic appendages, which are like the fat accumulations of the large intestine. Excellent. Here we have the superior meatus, I believe, from memory. And this is going to go to the posterior ethmoid sinus. Great. Sebaceous glands. I assume this is referring to sebum. Yep, excellent. The facial nerve branches within the parotid. So that is like the buccal, the zygomatic. There's another one. It's not the lacrimal nerve, is it? It might be the lacrimal nerve. I can't really remember. What have I said? I think I said. I'm just going to go with buccal and zygomatic. I think they're going to ask for all of the branches, but there's temporal as well. Okay, so I'll say that's hard. Xiphoid is needle is inserted inferior to the xiphoid process, angled towards the feet to enter the pericardium. So infrasternal angle. Excellent. The nerves. So we have our thoraco abdominal nerves. So that is T7 to T12, I think. And then we have our subcostal nerve, which is T12. The subcostal nerve is always T12, so that's not too bad to remember. The vestibulocochlear nerve has two parts, obviously vestibulo and cochlear, meaning balance and hearing respectively. Excellent. So a pneumothorax can be spontaneous, it can be an iatrogenic injury or trauma to the chest wall or the lung. Isovolumetric relaxation, that happens in early diastole. So the semilunar valves close, and we have the ventricles essentially relaxing following that ejection. And then from memory, this corresponds with ventricular repolarization for our ECG. Great. Deep cervical. So I know that it's the deep cervical. Basically, everything drains to the deep cervical before it enters the jugular trunk. But the location, it's not amongst the carotid sheath. I'm pretty sure that's what the superficial cervical is. But I'm happy to check. Oh, it is the carotid sheath. That's actually really annoying. So that means that this is with the internal jugular vein. External jugular vein. Okay, I'm going to redo that card. Function is sensation sensation and mastication, and the corneal reflex. We didn't really discuss the corneal reflex, but that's okay. This is the epitympanic recess, I believe. Yep, great. This is the number 4. That is the flexor hallucis longus. Great. Myotome is a muscle or group of muscles that's innervated by a spinal segment. That's the aorta. That is isovolumetric contraction, relaxation. I always get these mixed up. That's okay. Except the cricothyroid, which is innervated by the external branch of the superior laryngeal nerve. Yes. The fusion, the formation of male and female pronuclei. Somatic is obviously going to affect skeletal muscle. Great. This is the teres major. That is the lower subscapular nerve, and that's C5 to C7. We have the formation of pus due to neutrophil infiltration and tissue necrosis. foot inversion is L3 to L4, L4 to L5. That's okay. This is the xiphostomal joint. Oh no, hang on. That's the xiphostomal joint. Oh, come on. Yes. May occur during thyroidectomy due to the proximity of the superior laryngeal nerve. Damn it. Cells from the ectoderm migrate through the primitive node, creating the notochord. Feel the pressure.
Over for me.
Hello,
I'm
Shahab.
right now.
Welcome to the stream.
Appreciate it, bro. Thank you for continuing the stream while I was struggling to survive. I'm locked in now, though. 87 cards left on this MD1 past exam deck.
Why are you dying?
Bro, I don't know what it is, bro. I've been having like stomach flu, diarrhea, nausea, bro. The whole shebang.
That's not good.
I don't know what's happened to me, bro.
We know that the pelvic part of the ureter is going to move over the levator ani before entering the bladder. Great. Above the focal cords is going to correspond to the superior deep cervical nodes, and then below it's going to be the pretracheal, paratracheal before going to inferior deep cervical nodes. Okay. The middle ER already kind of said these things. So this is like contains the bones, contains the tympanic cavity, and contains the pharyngotympanic tube and the mastoid air cells. Okay, I'll come back to that. Tensor opens by cell swallowing due to V3. Tensor pali tentorium, I think it was. V or palatini. I just got my things mixed up. That's the somatic sensory area. Right. Fair enough. Vitamin D synthesis begins in the epidermis before continuing to the kidney. Taenia coli.
Yeah, Alessandro, let me test you.
Yeah, all right, let's do that instead of me slaving away over Anki.
Okay, so I have a question here.
Mm-hmm.
What category of drug is ACE inhibitors for pregnancy?
When you mean like that, you mean like what category of like a tetragen it is?
Yeah. You know how there's category A, B, C, D?
Oh, okay. Yeah, fair. I do not know.
It's category D. Name 4 adverse drug reactions related to ACE inhibitors.
So there's obviously drug interactions. You just said pregnancy category D. We have the cough.
Yeah.
We have hypokalemia.
No.
No, hyperkalemia. Pardon me, hyperkalemia.
Why?
And then we can have it's either postural. I think it's postural hypotension, but I might be getting it mixed up with orthostatic hypertension.
No, you
Or
got
the-
it. It's
Okay.
orthostatic postural hypotension,
Okay.
hyperkalemia, dry cough, rash, angioedema, renal failure of existing renal artery stenosis.
I missed
Why
that. Yeah.
is there hyperkalemia?
I don't know.
It's due to the fact that ACE inhibitors will reduce the excretion of potassium.
That makes sense.
Yeah, and then what is oligohydramnios?
I don't believe we've ever looked at that.
It's just in case they ever bring it up. Amniotic fluid is less than expected for gestational age, while polyhydramnios is the amniotic fluid is more than expected for gestational age. And the reason why I brought it up is because one of the ADRs for ACE inhibitors for pregnancy is oligohydramnios, neonatal hypotension, and renal failure.
Okay. Explain the pathophysiology of asthma.
Asthma, you have increased inflammation due to the exposure to an allergen. No, asthma, you have increased inflammation, which results in bronchoconstriction. So that's why you give short-acting beta-2 agonists to allow for bronchodilation.
4 marks for explain the pathophysiology of asthma.
4 marks? I basically
Yeah.
just got 2 marks there.
Even then, I wouldn't give you a mark for saying the short-acting beta-2 agonist.
Oh, true. And then you have inflammation present, a lot of inflammation. You have histamine release as well.
Mm.
And what else? Histamine bronchoconstriction, which prevents proper gas exchange. What is it?
So
Oh, give me one sec.
that's so good.
It's my mom.
Okay. Do you want me to keep talking, or are you muted?
Yeah.
Okay, everyone. I'm going to answer some broad questions from previous exams. I think that's probably a better use of tonight. So I might only be on here for 20 minutes if that's going to be the case, and then I'll probably move on to something else, in all honesty. Yeah, I'm probably going to hop off at 10 because I would like to get these cards done. Oh, I guess I can just do it now. I'll do it now. Okay. So, from memory, the superior phrenic vein is going to drain straight into the inferior vena cava, and I think that's on the right side, whereas the muscular phrenic, and it's not pulmonar phrenic, no, it's pericardial phrenic. Nerves are going to drain into the internal thoracic veins, and then inferior, it's going to be the inferior phrenic nerve. The right side's going to drain into the IVC, but the left is going to loop and drain to the IVC and the suprarenal vein from memory. I think it's something like that. It was exactly that. Fun. We know that watershed areas can spread over to multiple areas. Great. Jugular foramen is going to be 9, 10, 11 in internal jugular vein. Great. Deep cervical is going to be the carotid sheath, and it's going to correspond to essentially everything drains into it. Great. That's isovolumetric relaxation. This is the subcostal angle. This is the lateral rectus. T4, not T4, pardon me, fourth intercostal space. L4 or 5. Oops, L4, L5. We know that subclavian can go off musculophrenic and superior epigastric. Anterior intercostal arteries, then again musculophrenic. Okay. There's no blood to the kidney, so it secretes renin. So renin, angiotensin agenda to angiotensin 1 into angiotensin 2 by ACE. That's going to result in aldosterone being secreted by the adrenal cortex. That's going to result in increased sodium and water retention in the DCT. That's going to result in increased MAP, and that's going to result in decreased urine. Excellent. Cool. Direct attachment is when the endosteum of the muscle extends and fuses directly. No. The epimysium, pardon me, of the muscle extends and fuses directly to the proxium of the bones. And examples like our intercostal muscles. Great. May occur during thyroidectomy due to the proximity of the inferior thyroid artery. Great. The AV valves. Oh, that's fine. Yeah. So remember, tricuspid is on. Let me just read this actually.
Bro, my bad, bro. I was trying to show my mom photos of my shorty, bro, and she just keeps denying it, bro. Okay, what is okay? Sorry, explain the pathophysiology of asthma.
So you missed a couple of steps from memory.
Yeah.
So we know that with asthma,
Yeah.
So I think you missed like the whole trigger and mast cells thing.
So, yes, right. I did.
A trigger is going to activate mast cells, and that's going to lead to the release of IgE.
IgE. Oh, why did
Yeah, you really fumbled on that.
Bro, how did I fumble? I know this too. It's like I don't know why I did. I fumbled that, bro.
And then we know that we're going to have our histamine, our prostaglandins, and our leukotrienes being released, and that's going to result in bronchospasm. And I think you also forgot the mucosal edema.
Bro, I don't know how I messed that, bro. Generally, I know this too.
And then that's going to result in reduced FEV1 as well as just like obstructing the airway in general.
Yeah, easy. Bro, I can't believe this. Thanks, bro. Generally.
Well, I'm going to do my Anki cards, but I'm happy to fire you more questions.
All right, easy. I'm going to mute myself and just rip through these cards as well. If I come across a good question, I'll unmute myself and tell you.
Yeah, no problem.
Well.
The right is more palpable than the left upon inspiration, I believe. That's a different card. Upper poles like near. This is the issue. I have too many cards. Is this loss of corneal reflex? Yes. Loss of taste as well. Okay, fair enough. That's the arc of the A. No, that's the pulmonary. Oh, no, that's the aorta. Hang on, am I getting mixed up? Where am I located? fair enough. Above the vocal folds, we know this is going to go to the superior deep cervical nodes. Great. Smooth muscle, that's fusiform, spindle shaped, non-striated, but crisscrossed by myosin. That's anchored to dense bodies. We have a single nucleus. Am I forgetting anything? Oh, it can be up to 200 micrometers. Only has endomysium. And then the function is obviously smooth muscle, like anything like peristalsis or segmentation in the intestine. That's typically the big one. Yeah. Yeah, I'm pretty happy with that. This is a Taenia coli, so 3 longitudinal bands of smooth muscle that assist with peristalsis. That is the cricoid cartilage. Great. Skeletal muscle, yeah. We have compact and spongy. So compact has hervatians or the osteons, and spongy does not. The roof is formed by the inguinal ligament. I feel like all these questions are going to pop up. The internal abdominal oblique and the transversus abdominis. This is the spinosum, foramen spinosum, which is where the middle meningeal artery is. Great. Nerve supply of Carlot's triangle. I assume C3 to C5 as well as T7 to T9. Yep, so right phrenic nerve and then sympathetic T7 to T9. The oblique angle is meant to prevent vesicouretic reflux. Great. The arteries, so we have the anterior spinal artery that supplies up to, I think, 2/3 of the spine. We have the posterior spinal artery, and then we have the medullary segmental, or maybe segmental medullary artery. I can't remember the exact name, and that involves like the artery of Adam Kibwitz, or however you do pronounce that, segmental medullary artery. Including artery of Adam Key with. I'm not even going to try to pronounce that properly, unfortunately, nor type that correctly on the day. Submandibular ganglion through the facial nerve via the quarter tympani. We'll come back to that. That's the optic nerve. That is the costal parietal pleura. Middle meningeal, dilatation of the quarter tympani. No, quarter tendinae. I'm getting my things mixed up. Yo.
Explain the MOA of disulfiram.
So disulfiram is used. I don't want to use the word in alcoholics, but in alcohol-related therapy, potentially for addicts, because it's a competitive antagonist with aldehyde dehydrogenase. And so alcohol is metabolized by alcohol dehydrogenase into acetaldehyde, but then it cannot be further metabolized. So that effectively results in feelings of nausea for individuals that do drink alcohol. And then that it acts as a way for them to stop drinking alcohol.
Easy, perfect. 10 out of 10.
Easy. What is a skin ulcer? And describe the histological appearance of an ulcer.
So a skin ulcer is a loss of the epidermis, basically? No?
Yeah.
The loss of the skin lining of the skin, and histologically, I don't know how it looks histologically, to be honest.
So I
What
would
is it?
say that a skin ulcer is like a defect or like an excavation in tissue. It doesn't necessarily need to be in the epidermis. I think your choice of words hurt you there because you can have a gastric ulcer.
True, but I heard skin ulcer, so I
Yeah,
was thinking.
yeah. I don't know why I said skin ulcer, but yeah.
But histologically, how does it look histologically?
So we know that like the common causes of ulcers is like ischemia plus inflammation.
Mhm.
So you can kind of imagine that, especially because like it's not like resolving by first intention; it's resolving by second intention. So you're going to have like a lot of granulation tissue. You're going to have angiogenesis. You're going to have inflammation. So you're going to have neutrophils and potentially pus.
Okay, perfect.
And you're going to have a damaged basement membrane.
Okay, perfect. Thank you.
Yeah, because like ulcers can fully repair, but like there's a lot of granulation tissue there. We'll redo that. This card keeps popping up. Middle ear. Mastoid air cells, the pharyngotympanic tube.
I'm still gonna try to sleep and stay on the stream though.
Huh? Oh, that's okay. I'm happy to keep going. Just put your phone on silent if you have to study. No offense. But anyway. And the tympanic cavity. Okay, fair enough. The facial nerve and the tensor tympani. The tensor tympani and the the staple nerve. The facial nerve. Okay, that's fine. Oh my gosh, tensor something palatini. It begins with T. Taylor? Veli Palatini. Okay, I'm just going to speak that with an Italian accent. That's fine. You want to check for just enlarged lymph nodes in general. Yeah. Great. That's the corniculate. Great. That is the cerebral spinal fluid, or subarachnoid space where the cerebral spinal fluid occurs. Okay. Skin, subcut, supraspinous, interspinous, epidural, dura, subarachnoid. Okay, give us internal thoracic arteries and then the muscular phrenic and superior epigastric arteries. Great. This one's haunting me. Vagus nerve, I just can't get to save my life. Foramen magnum gives off the right superior lobar bronchus before entering the hilum. Great. Voma, great. This is to constrict the neck of the bladder or the internal urethral sphincter. Yeah, close the bladder neck. That is the internal spermatic fascia, and that's going to correspond to the external oblique. Did I say external spermatic fascia or internal spermatic fascia? Because it's skin, superficial fascia, external oblique goes to external spermatic, then internal goes to detrusor, then transverse abdominis stops, then transversalis fascia, which goes to internal spermatic fascia, and then parietal peritoneum, adipose tissue. That's okay. Frontal ethmoid sphenoid, great. The midline is, the poles are more towards the midline and higher than the lower poles. Yeah, that's fair enough. This is a transverse arytenoid, oblique arytenoid. This is the transverse arytenoid. I am a bozo. Yes, I am. This is perinephric fat. Great. We know that the splenic vein catches up with the superior mesenteric vein and enters the hepatic portal vein, and that goes to the liver. Great. Again, this could kind of be anything. Yeah, I really have to. Yeah, that's right. Extends from the second to the sixth rib. Deltoid, C5, C6, next the axillary nerve. The impressions of the right lung. Superior and inferior vena cava, the arc of the azygos. Great. And the right atrium. That's fair. Yeah, the cardiac impression is pretty obvious because that would be the right atrium. And then this will be the left atrium and left ventricle. That is the right sternal part, right costal part. I'm a moron. This is V3 and X. The origins from the medulla. Articular cartilage located on the outside serves as a hard protective shell. Spinous processes bipedal with the exception of C7. Bifid. Okay. Submental is inferior and posterior to the chin in general. The floor of the mouth, the tip of the tongue, and the lower lip. Great. The juvenaculum guides gonadal descent. Great. Innervation is glossopharyngeal. The genital branch of the genital femoral nerve, the ilioguinal nerve, and the round ligament of the uterus. Great. Precise arrangement. Yep. The testicular artery. No, I already have the testicular artery. The cremasteric artery. Yeah. The subdural is a potential space. That's fine. Yeah. The hypophyseal fossa and the petrous part of the temporal bone separates the. No, hang on. Am I getting mixed up? This is way basic than I thought. Yeah, because here's the hypophyseal fossa card. Yeah, and that's in the middle cranial fossa. So this is just going to be anterior and middle, and this is going to be middle and posterior. Great. That's interspinous. Found in places where the bone is close to the skin, or rather where the bone rubs underneath the structure of the skin. Yeah, friction. Among the sublingual folds, yeah. Boundaries, cystic duct, common hepatic duct, inferior border of the liver, parasympathetic via the chorda tympani, through the submandibular ganglion, and then the facial nerve. Yeah. Great. Collecting ducts. Cerebellum. Broca's area, that's the production of speech. the tensolephalon, the diacenephalon, the mesocephalon, the met, the mile. Great. The tunica media is smooth muscle primarily, but it also depends on the type. So smooth muscle and collagen. Thickest in arteries, thin in veins, absent in capillaries. This is the middle meatus. That is the anterior and middle ethmoid sinus, the maxillary sinus, and there's one more. There is none. Okay, it's only those three. Great, I'm pretty happy with that. That's alveolar duct. That is left marginal. Buccinator. I'm doing the motion. You can't see me, but I'm doing the motion. That's where you suck your teeth in. And suck your teeth in. Sorry, it's where you suck your cheeks in. My goodness, you can't even suck your teeth in. About 25% of breast leaf drains to the parasternal nodes, which run along the internal thoracic vein and artery. Great. The asterion is posterior superior to the mastoid process of the temple bone. Above and lateral, posterior superior. Yep, that's fine. Clinical. You have the impairment in the muscles of the tongue, and I believe the tongue points towards the direction, like what side the nerve lesion is on. Yeah, tongue deviation towards the lesion. Here we have the marginal zone between the red and white pulp, and that's where antigen-presenting cells like to hang out. Great. This is the groove for the inferior vena cava running a tube. Yep. Posterior boundary. I'm just kind of tracing like the ilium. So the iliac crest, the inguinal ligament, the pubic symphysis, and I'm missing one. I assume anterior superior iliac spine. Am I an idiot? Yes, I am. I was saying these ones. Posterior, lumbar vertebrae. Okay, we'll do that. I'm getting my cards mixed up, unfortunately. This is 9. What elevates the ribs when the scapula is fixed? Serratus anterior. Protruding mass usually... these usually resolve, I believe, after like 3 to 4 years, but I think this card's going to say due to a weakness in the abdominal wall. Yeah, when they fail to fuse. Okay. We're having an argument about this one today, so nothing too crazy. Actually, Shahab, is that what we said today?
You guys were saying symphysis.
Okay, so Shahab was wrong. Fair enough. Because I always get it mixed up too. I'm actually going to check that.
Symphysis is right in the middle. That's where the joint is and the disc is. So there's no way that it could join there.
Hello, Amel. How are you?
Hello, Wale.
It's got to be tubercle. It's a clinical sign.
Every time this comes up, Shahab swears black and blue that it's tubercle, and I started to believe him because of that.
He says symphysis, yeah.
Yeah, he says symphysis. Sorry, I'm getting mixed up now. Gosh, I'm a bozo. Oh, come on, chat. Just work with me, please. Don't give me like the whole story of like the evolution of humans. It's giving me embryology. Why is it giving me embryology?
Wait, did you check the mid-inguinal point and the midpoint of the inguinal ligament as well?
I will check that. Yeah, it is the pubic tubercle.
All right, I'll see.
Oh my goodness. He swears black and blue that it's the pubic symphysis.
No, he just says, "Oh, this is what the cue card says."
Oh yeah. He tries to argue saying this is what the Anki card says, and it's like, well, who wrote the Anki card?
Yeah.
Next time he says that shit, beat him black and blue, bro. Be like, no, bitch. I know better than you at this point.
Are you guys learning from my cards?
Yes, sir.
Yeah.
I'm actually doing double learning. I'm doing my own cards while listening to you.
My cards
That's-
are actually pretty ridiculous. Like, because I wrote them, like I know like what the line is.
Yeah.
But like, and as you can see, like even like I get it wrong like pretty often as well.
Mm-hmm.
Like I get it wrong pretty often as well. But like if you were like a newcomer to my deck at this point in the game, you'd be screwed. No offense.
Yeah.
Just give me a second. I gotta move.
Thank you, Hanjan, sir.
Oh, Hanjanasa. Hanjanasa, nice to meet you, Hanjanasa. Harigato. Hanjanasa, my daughter is sick. We need a donation.
All right, let's continue with these cards. So clearly pubic tubercle, but anyway, dilatation of the ventricular dilation, because I've done artery dilation. Second card, ventricular dilation can pull the pap muscles downwards, preventing closure of my AV valves. This is my subarachnoid space. This is my oblique retinoid. Again, this could kind of be anything, but I think this is how they articulate towards each other. So we know that the handle of the malleus goes to the tympanic membrane, then the incus, and then the stapes has its foot plate at the oval window. Great. This is the right costal part. I can't believe I got that wrong earlier. Saddle joints are similar to condyloid points, but they allow more freedom of movement. So an example is the metacarpal hang on. Hang on. These are metacarpal pharyngeal. The next one is. I'm a bozo. It's so similar to this. I think it's the carpal metacarpal. Is it? It is. Damn, that's an L. I'm gonna skip that card. 3 to 5 layers thick. Cells stop dividing and they begin becoming filled with keratin, and it creates a tight impermeable seal. Great. Yeah, that's fine. Runs through the right coronary sulcus. This is the nason. Begins at right sternoclavicular point. Again, this card keeps getting me. Anyway, and yeah, that's fine. sigmoid sinuses into the internal jugular vein. Great. I'm actually going to double do that card. The notable dermatonal jump is C4 to T1 because you don't have C4 to T2, pardon me. I know what I'm doing, I just can't verbalize myself. Facial nerve is the internal acoustic meatus, and that's going to go through your stylomastoid fossa, and then that's going to go through your chorda tympani, and then that's going to go to, where does it finish? Parotid gland. Oh, other way around. Where does the chorda tympani go? That's a good question. Internal acoustic meatus, facial canal, stylomastoid foramen, and then beyond that. Fair enough. This is the tensor veli palatine, V3. It opens when the pharyngotympanic tube opens when swallowing. Great, I finally got that. That's fine. Drew, any questions about this one?
Pulmonary systemic. Is it? No, looks good.
Cool. So just remember, obviously, tricuspid's right, bicuspid's left.
Mm-hmm. How many cusps do the semilunar valves have? They're all 3, right?
The semilunar valves.
Yeah.
I don't think we need to know that.
Okay.
I'll be completely honest. I haven't looked at that. That's very low yield. If you like, I've started looking through the past papers, and they're pretty, like, they're questions that everyone can answer.
Yeah.
Like MCQ is like a bit of the Wild West, obviously, but like remember, technically the answer's there for MCQ.
True. Exactly.
Yeah. So the pharyngotympanic tube, it connects the E to the nasopharynx. Connects middle ear to nasopharynx. All right, I'm going to be more specific. That's the stylohyoid. That's the mild. Where's the stylohyoid? Am I a bozo? I am. That's the stylohyoid. That's digastric posterior. That's sternocleidomastoid. That is your that's your submandibular gland. That's your parotid. That's your mylohyoid. That's your digastric anterior. That's your hyoid. That is the 2 heads of the sternocleidomastoid. That is this is your omohyoid inferior. This is your scalenes. That's your levator scapulae. So I just made a minor mistake, but I do kind of know my way around. Yes. Sorry. Posterior boundary, we kind of ran into this earlier. So that's the diaphragmatic crura, the lumbar vertebrae, the soleus major and minor, and that should be 4. Lumbar fascia. Fair enough. I'll just take that. So responses. So we know that the autonomic nervous system is primarily responsible for like smooth and cardiac muscle. So I assume that's what this is going to be referring to. Excellent. Foot eversion is going to be L5S1. Great. The hyaline nodes are then going to go to the celiac nodes. No, not. Am I an idiot? I think it's the celiac nodes. Oh, no. I got mixed up. Oh, this is a lung. Oops. Anyway, I'm really selling. Medial accurate ligament. Yes. We had this earlier, so the marginal zone between red and white pulp is where antigen-presenting cells like to hang out. The cord carries lymph. Yeah. A congenital cystic lesion, commonly found near the orbit and midline. This is mutations in PKHD. Yeah. Complication. This one actually cause blindness, but I got to think of how it does it. Something erodes into the orbital wall. I can't remember where. I'm going to assume nasal, but I don't know what it is. Nasal drainage blocked. Ethmoidal cell infection can erode medial orbital wall, causing blindness. Okay. So the glossopharyngeal, that comes from the medulla. Vertebral body is heart-shaped. This is the interior ramus. This is the pterion, which is the intersection between the frontal, sphenoid, temporal, and parietal, and that overlies the middle meningeal artery. Great. The parotid is the facial. No, the parotid is the. Hang on, am I getting something wrong? No, the parotid is the glossopharyngeal nerve. Yeah. Head of the ulna is distal. This is dura, phylum. Indirect attachments are more common because they are tougher. Well, they're more durable, I think I put here. Yeah. So the earlier levator scapulae, that's the sternocostal surface. I think this is the nerves, I think it's here. So nerve supply is going to be glossopharyngeal on the internal part of the tympanic membrane. I also think quarter tympani hangs out here. Is there something else? I think maybe tensor tympani, but I can't remember how tensor tympani fits into the picture. It's just facial and glossopharyngeal. Okay, fair enough. We do that. Oblique fissure goes from T2 and runs obliquely across to the sixth rib. Good night. Great. Medial rotation. That is the subscapularis. Great. Completion of the male pronucleus. Yep. Muscular sized arteries have, well, walls. No, that's the big one. What's this one? The big ones are walls are chiefly elastin. What's this one? This is just muscular muscle. Right, they have many bands of smooth muscle in the tunica media, and they do that because they're important for regulating blood supply to organs. Fair enough. We just had this. This extends from the aces to the pubic tubercle, not the pubic symphysis. This is the inferior border or inferior margin, inferior border. The function of the vagus nerve. The vagus nerve trips me out. I might have to actually talk to someone about that. The islets, they're located in the pancreas. They are highly vascularized. Betas are particularly in the tail from memory. They are endocrine regions of tissue, meaning that they secrete hormones. I don't really care so much about the size. And they're not going to ask about the size in a million years. Great. The diaphragmatic cillae, however you pronounce it, covers the pituitary. The peripheral nervous system is the cranial nerves plus the 31 spinal nerves. Great. Below the accurate line, all the muscles are in front of the rectus abdominis. Or aponeurosis is of the muscles, pardon me. Petrous temple is 7 and 8. Yep, great. Saddle joints. This is the first carpometacarpal joint of the thumb, and they are similar to condyloid joints, but allow more freedom of movement. Parietal pleura, located midway between the umbilicus and the pubic symphysis. Cervical, atlas.
Can I go? Sorry.
Yeah.
Have fun.
Are you going? That's all good. See you next time.
See ya.
Give me a second. I'll be back. Okay, I'm back. All right. Cervical. So we know that the axis has extends. The atlas does not have a spine. And I assume the only other thing is like C7 vertebral prominence. Great. But I'll like to do that again. This card, man, is frying me. Yeah, well, the bones are obviously going to amplify and transmit vibrations. I think that's the whole point that they're there. C4 to T2 due to the absence of T1. Course is going to be the internal acoustic meatus, the facial canal, the stylomastoid foramen, and then it splits into its various branches. So we have like the it's called mandibular, but like it's not actually mandibular, but it's buccal, zygomatic. I'm going to give one more. Temporal. Yeah, mandibular, but like there is already a mandibular nerve, so I don't understand why. Anyway, but that's what the chat says. Vagus nerve keeps frying me, which is fun to hear. That is the mylohyoid. That's completely fine. Those targets the vestibule and cochlea, like hence the name. But anyway, subarachnoid hemorrhage is cerebral artery. Yeah. Between the arachnoid and pia mater, associated with the thunderclap headache. Yeah. Middle E to the nasopharynx, pressure equalizers, to equalize pressure across the tympanic membrane. Hilar nodes, and then the hilar nodes go to the tracheobronchial nodes. I got this wrong. I genuinely thought that this was celiac, like it's the next line, but I just completely was backwards on this. But yeah, tracheobronchial nodes. It targets one of the muscles, the stylopharyngeus. It also targets the carotid sinus and the carotid body. It also targets the parotid gland. And then I don't know what else it does. Posterior third of tongue. For both taste and sensation. Okay, I'll make a note of that. That's omohyoid. Sperm swim towards the fallopian tubes. That's fine, yeah. Because we know that they articulate with the heads of the ribs. I'm playing with a little fidget cube whilst I do this. I'm usually a lot quicker, but I'm guess articulating myself is slowing me down. But yeah, I'm having some fun. I'm gonna try to do this more next year. It can cause blindness through if you don't have proper nasal drainage, that can erode into the medial orbit, medial wall of the orbit, cause blindness. PP cells emit pancreatic polypeptide, which regulates exocrine processes. Yeah. Oops, I don't want to give that a 4. I want to press that as good. Targets. So, firstly, it's responsible for pupil constriction, and then it's responsible for essentially all the muscles. So we have superior rectus, inferior rectus, we have medial rectus, and we have inferior oblique. And the levator palpate. Yeah, so that's actually how it results in ptosis. But levator let me redo that. This is the inferior rectus by number 3, which we just said. Contains the, I assume this is going to refer to the internal urethral sphincter. Yep. Beck's triad, hypertension, raised JVP, muffled heart sounds. Great. It's composed of cholesterols, fatty acids, and carbohydrates, which are all produced by sebaceous glands or just associated glands in general. Yeah. A bursa, it's just like a little fibrous, lubricating ball that prevents friction near joints or near areas of movement where the bone or muscle can underlie, where the bone can rub against muscles or skin. Yep. Phylum, we had that earlier. This is the, what is this? Spinal ganglion. Yep, great. This is the interoceptors. Yeah, I don't actually understand what they are, but I just know the name. Located at the junction of the coronal and sagittal, the future site of the bregma. Great. That is my vertebral spine. I assume this is going to refer to the superior mesenteric and inferior mesenteric. So superior mesenteric goes from the second part of the duodenum to the lateral second third of the transverse colon, and then the hindgut starts, and then the hindgut is drained by the inferior mesenteric nodes. Great. I assume this is saying like they act in opposite to each other, but another thing it could say is sympathetic is like diffuse and like not really localized, but parasympathetic is. So it could say two things. Yeah, it was the second one. So sympathetic is diffuse, parasympathetic is discrete. Origin of the medulla. The ovale is the mandibular nerve V3. That's the cranial, not cranial nerve, spinal accessory nerve that innervates the trapezius. This is killing me. I can't get the vagus nerve to save my life. That is the extensor hallucis longus, L4, L5, and that is the deep fibular nerve. That is the esophageal impression. Again, this is kind of ruining my life. Internal jugular vein goes the medial end of the clavicle, and it runs with the sternocleidomastoid. Well, it really runs through the carotid sheath, but I guess that's related to the sternocleidomastoid, as I put here. Yeah. The subclavian triangle, that's going to be the interior border of the trapezius. Great. Short limb, pardon me, is going to attach to posterior wall, I think. Yeah, posterior wall. This is the annual joint cavity, synovial sheath, and annual ligament, respectively. Not respectively. Joint capsule. That's fine. Yeah. Drains via multiple small ducts. Quack, quack. Cardiac tamponade can effectually, well, it's like trying to pump in a balloon, you know. It just limits the contractility of the heart, which can affect cardiac output, and then that can affect, you know, everything else. This is my transverse articular process, transverse costal facet. Anyway, dermis, LE blastocyst with zona pollutia. No, is it zona pollutia or corona radiata that's being lost? I think it's zona pollutia. Yeah, being lost. Excellent. Cervical, already kind of said this. So the axis has the dens, the axis has no body or spine, and we have the C7 vertebral prominence. This is the anterior abdominal wall, the left lung and pleura, left costal margin, left lobe of the liver, and the diaphragm. So there's the 5. Unpaired is thyroid, cricoid, epiglottic.
Okay, guys, I'm headed to bed.
Are you going?
See you guys tomorrow.
No, don't leave me. I'm there. Are you there? Ah, he's gone. Good night, bro. All right, let's get back into this. So unpaired is thyroid, cricoid, epiglottic, and then paired is arytenoid, cuniculate, and cuneiform. Great. Where am I? Ophthalmic, maxillary mandibular, corneal reflex is associated with V1 for memory, and then V3 is the muscles of mastication, such as your pterygolds and the interior tongue. My goodness, the tongue I keep missing. The inferior pancreatic duodenal that drains into the superior mesenteric vein. Yep. The functions are to contract the bladder and relax the internal urethral sphincter. I should be more specific. Yeah. Contents is the inferior part of the internal jugular vein. Lies inferiorly and rests on the body of the prostate, or upper surface of the prostate. I need to say prostate. Olfactory nerves, that's through the ethmoidal plate or the cribrium plate of the ethmoid. Epiphyseal plate is, yeah, that's fine. And that is your sternohyoid. This is the external. Oh, I forget actually what this was. The external jugular vein. Yeah, because it's superficial, so it would be external. Yeah, and that's posterior auricular and parotid regions. Yeah, right. We had this earlier. So this is going to target the posterior 1/3 of the tongue, the parotid, the carotid sinus, the carotid body, and that styropharyngeus, whatever the hell muscle is in the tongue. Great. Sensorineural has to do with potential, well, loud noises, I guess, can cause sensorineural damage. You can also have defects in the glossopharyngeal nerve, or just defects in the ER, such as like the cochlea. Yes, that's all right. This is blowout fracture, affecting the infraorbital nerve with sensation in like the cheek. Yeah, great. Lumbar, that's fine. We know what they look like. That's why I think this is just adductors, which is the obturator nerve L2 to L4. I assume this is going to say the adductor longus, but it's probably just going to say adductors. Adductor magnus, fair enough. I'm not too concerned. I had this question today with Shahab. No, hang on. He got it wrong. Interesting. That's okay. Yeah, he said meta. I said meso. He said meta. He actually got the order wrong too. That's right. I'll redo that card anyway. We already kind of said this, but it's also the levator. Begins with P. Paryngeus. Palpebrae. Fair enough. I suck at Vegas. I just can't seem to get that. Aortic arch and carotid sinus. Pronation and supination. Yeah. Hemothorax. Notochordal process elongates by vagination and cells for primitive pit. The primitive pit extends into the notochordal process, forming the notochordal canal. Extends cranially from the primitive node to the precaudal plate. Full fuses with underlying embryonic endoderm. Plate infolds to form the notochord. C7 vertebral prominence. T7, the inferior angle of the scapula. Is it T2 or T3 that corresponds to the superior angle of the scapula? Something corresponds to T3, I think. T2 or 3. Then we have the iliac crest. I think that's at L4, I think. And then we have the sacral dimples. That's at S2, I think. T3. All right, we'll redo that column. The horizontal part of the duodenum, I remember it's like the sandwich. It's sandwiched between the aorta and the inferior vena cava, as well as the SMA, SMV. Yeah. Again, this vagus nerve is killing me. Is that frontalis, temporalis? Anyway, I'm a high order inferior. What is this? Poor drainage can cause negative pressure or effusion. That makes sense. I assume this is talking about the scapular T7 apex beat. Mid-clavicular line. Oh my gosh, that is a really bad mistake. Anyway, we know that the functions that transmit vibrations from the tympanic membrane to the oval window. Great. That is the... What is that? That is anterior posterior ethmoidal. That's Kisselbach's. That is the septal branch of the labial artery. That is the sphenoid palatine artery. And what's this? I love it how I can, the one that I don't know is the one that they're asking. Palatine artery? Greater palatine artery. I'll redo that. That's fine. Yeah, we already spoke about this tonight. Metacarpopharyngeal joint. Yes. The cranial clavaria. Internal oblique. Again, this could be anything. Fair. I'm going to group those. That's what I'm going to do. Give me a second. I'm just going to fix this card up because I've made so many ridiculous mistakes on that card. The only way that I can think of it is just by doing this. Don't do this to me, please. There we go. There we go. Okay. Yeah, I don't know why I had it out of order, because clearly white carries preganglionic to the sympathetic chain. And then the grey is going to carry from the chain the postganglionic to the spinal nerves. I think that fixes up my mistake, actually. Vagus nerve is killing me. This is the blastocyst cavity. Oh, no, this isn't the blastocyst cavity. This is the epiblast and the hyperblast from memory. The epiblast is columnar, and then the hyperblast is cuboidal. Nice. That was the transverse costal facet. That is the inferior angle. C5, C6. It's just C5. That's a bad mistake, actually. Abdominal contents are covered in a peritoneal sac. Yeah. This is the autonomic nervous system. We've already kind of spoken about that tonight. So involuntary control of, I guess skeletal muscles can technically be involved, but primarily smooth and cardiac muscles. Yeah. Internal iliac, superior vesicle, and then inferior vesicle for males, and the vaginal artery for females. And then logically, the corresponding veins come along too. Head is located. Well, I know that the head articulates with the incus, but I don't know. The epitympanic recess. Pardon me. Yes, good. Radiolucent and radio opaque, respectively. Great. V1, V2, V3. V3, there was something that I got wrong earlier. It was the anterior part of the tongue. Yes, for sensation. V2 is greater than V1, which is greater than V3. Yes, it's out of order. Or is it 2, 3, 1? I know 2's first. I think it's 2, 1, 3. I mean, I think it's completely out of order. 2, 3, 1. Of course. Cambrian plate of the ethmoid. Yeah. Otitis media is the. Oh my goodness. Yep. That's typically the middle meningeal artery between the perosteum and the meningeal dura. This is your crescent shape from memory. Yeah. That's fine. Like, we have to know that. Contains melanocytes and medical cells. Yeah, that's fine. Hypoglossal nerve. This is the thoracic wall. And that's fine. Obviously, it's intercostal. Cambrian plate of the ethmoid. This is the frontal sinus drains to the middle meatus. Yeah, takes me a second to work it out. Red pulp is where, what do you call it? Aging red blood cells are phagocytosed by the reticular endothelial cells. Red blood cells last about 120 days. Great. The Archanet process is a posterior inferior process of the pancreas, and I believe it goes behind the SMA SMV. Posterior medial extension. Okay. This is the base. Maxilla. Maxilla, palatine, occipital, temporal. I need 2 more. Is it mandible? No, hang on. I second guess myself. That's okay. Woodruff's is in the back of the nose, and that is more common in older people, but also more severe. The pons. I don't know what the nucleus is. Facial motor nucleus, fair enough. Mixed spinal nerve is going to be formed by the anterior and posterior root. So anterior is motor, dorsal is ventral. Dorsal is ventral, please. Dorsal is, or posterior rather, is sensory, and they're going to co-inverge and create a mixed spinal ganglion. A mixed spinal nerve, and then they're going to exit as anterior and posterior rami through the IV foramen. I missed that part. This is good, actually. Yeah, the ureteric bone arises from the mesonephros. Yeah. Babinski's, yeah, we know the top. This is the one from earlier. So let's go in order. So C7 is vertebral prominence. Obviously, C1 is axis atlas. C2 is axis. C7 is vertebral prominence. T3 is the superior spine, or the spine of the scapula. T7 is the inferior angle of the scapula. L4 is the iliac crest, and S2 is the sacral dimples. Nice. Temporalis. Continuity. Paranasal are continuous with nasal. So these are continuous with the nasals. So they can cause sinusitis. That's fair. No, let's do that again. Function, concentrate and store the bladder. Concentrate and store bile that they can release in digestive processes. Yeah, like the cystic duct. And then that goes down into my bile duct, and then that meets up with the pancreatic ducts to form the hepatopancreatic ampulla that then drains into the hepatic pancreatic sphincter, also known as the sphincter of Oddi, at the second part of the duodenum. Great. Right fifth intercostal space in the clavicular line is the apex beat. Clinical, again, the vagus nerve is killing me. The base fits into the oval window. Yep. Cranial base. Yeah, this is what I'm getting. This is what I keep getting mixed up with. So does that match the other column? Well, it was maxilla, vomer, ethmoid, sphenoid, and then it was occipital and temporal. Oh, it does match. Oh, okay, I'm fine then. Okay, fair enough. This has to do with equalizers. No, I already said equalizers pressure. What is this got to do? Negative pressure or effusion due to poor drainage. Okay, that's platysma. Papillary. Okay, papillary and reticular dermis. Yeah. So in order of superficial to deep, facial nerve, retromandibular vein, and the external carotid artery. That is the greater palatine artery. Thank you for that. Jugular foramen is Why am I slow tonight? I'm getting slower. Damn. 9, 10, 11, and the internal jugular vein. Adductors are my oblique transverse arytenoids and my lateral cricoarytenoid. This is Siemens law. Simon, whatever his name is. Simon's law. Yeah, Simon's law. The abductors get more messed up than the adductors. Simon's law. So that means that the posterior cricoarytenoid is the first to go in the case of a lesion on the recurrent laryngeal nerve. Fair enough. So this is lateral, and this is the oblique transverse arytenoids. Well, yeah, that's fine. L5S1 is sciatica. C5, that was a really bad mistake. That is the cochlea? No. What is this? Am I slow? What should be something dumb like the... Oh, okay. I assume external ear, middle ear, inner ear, internal ear. Oh, the small bowel has no hostia. It has volvulate conivents. It has many small loops. So with a small diameter. And we can see air fluid. Great. Again, vagus nerve is throwing me for a loop. Responses, I assume this is referring to skeletal muscle. Yep. Horizontal is across the fourth rib. Lateral, anterior, the anterior view, just all the bones. So inferior nasal concha, maxilla, mandible, frontal. You can't really see the vomer. Zygomatic, because the cheekbones. In superior, supraorbital, and infraorbital. Yeah. Okay. 2, 3. 2 is worse than 3, which is worse than 1. Vascular compression of the trigeminal root. This is the levator prabulae. Yeah, fair enough. And then everything else. I'll take that, actually. I'm not going to lie. Epididymis, sedum, semical vessel, vas deferens. Yep. Who's there? Who did I just hear? Oh, man, you're still here. The genoglossus, the thioglossus, and the hyloglossus. Great. Vertical line through the inferior angle of the scapula at the 7th intercostal space. And we said that many times tonight, so I'm not too fast. How do I mute Mayor? Because that's not my audio. Yeah, I better not touch that because I'm going to lag out. Okay. Let's keep going. Oh, so the roof is going to be the superior thoracic aperture. Actually, no, it won't. It will be the suprapleural membrane, or the cervical pleura of the lungs, pardon me. And then the floor is going to be the diaphragm. Yeah, suprapleural membrane. C8 is your pinky finger. Stomach has haustral folds. Position is pretty obvious. Left upper quadrant. It has the gastric bubble typically. Give me a second. I'm going to make myself a coffee in a bit. Yeah, I'm going to make myself a coffee soon, or a hot chocolate, whatever I feel, whatever I want more. I got this nice fidget cube today. It's really cool. It has like all the digestion, the eye. I haven't learned about the eye yet, but yeah. The lungs, the brain. Has a pretty detailed picture of the brain. The nerves, the blood, the muscles and the bones, and the heart, the lungs, and waterworks, and the ear. Well, I actually need help with the ear. So interesting. They call it the Etruscan tube on here, whereas obviously we say the pharyngotympanic tube. I wonder if it is something different. Hammer, anvil, stirrup, the pinna, the canal, messages to the brain, the semicircular canals, the auditory nerve. This is like really cool. Anyway, I'll maybe share it another day because I'm on the last one here. Fair enough. How long was the streaming going for? Only an hour and 43 minutes and everyone tapped out. What is this? Anyway. So the superior phrenic artery is going to come from the aorta, and then the muscular phrenic and the pericardial phrenic are going to come from the internal thoracic artery, and then the inferior phrenic artery is going to go into is going to come from the abdominal aorta. Excellent. Very happy with that. We literally just had this, so it's going to be the maxilla, the sphenoid, the palatine, the vomer, the occipital, and the temporal. I actually really struggled with this card so many times in the past, but it's good to know that I got it. Again, Vegas is throwing me for a loop. Exits via the IV foramen, pivot point. This is like atlas and dens. Uniaxial, uniaxial rotations. Great, pretty happy with that. Continuity, the paranasals are continuous with the nasals, the nasal sinuses. So if you have a little infection in your nose, in your nasopharynx, that can cause sinusitis. Great work. That is my descending aorta. Great. That is my epidermal ridges. Great. This is my... So the terminal branches is the superficial temporal artery, the maxillary artery. Then I have the lingual, facial, occipital, posterior auricular artery. ascending pharyngeal artery, and I'm just trying to think of the image. Superior laryngeal artery, a superior thyroid artery. Oh my goodness. That's contractility. That's fine. That can change the inotropic factors. This is my epigastric. That is my muscular triangle. That is my that is my lateral. No, not lateral. Medial. My articular surface of my medial condyle. If I make a mistake like medial lateral in the exam, I will cry. This is the. Is this posterior digastric? Median plane of the neck. Okay. The spleen derives from the mesoderm. It is derived from a condensation between two layers of the dorsal mesogastrium. Okay, I kind of struggle with that. Poor drainage can result in negative pressure or effusion. That's my mycin. This is my Passian. Optic canal is the ophthalmic artery and the optic nerve. This is the biceps brachii. This is the long head tendon. Yeah. This is two motor neurons, pre and post. Scaphoid, lunate, triquetrium, pisiform, trapezium, trapezoid, capitate, hamate. Pretty happy with that. Posterior mediastinum has all of, I like to say all the tubes. So it has the azygos, it has the, what do you call it? The arc of, well, not the arc of the aorta, but the descending aorta. Yes. Thoracic duct was another one. Esophagus. I missed like the big one. I'll redo that card. That's left costal part. The cells that remain on top form the epiblast that eventually becomes the ectoderm. Great. Origin is the medulla plus C1 to 5. Yep. This is haunting me the whole night, this card, and the other card too. Tensor palatini. I don't know. Oh, what? Anyway, adductors is going to be lateral cricoarytenoid and the transverse oblique arytenoids. Yeah, I said this earlier. Walls are chiefly composed of elastin fibers for large elastic arteries. So they receive cardiac output under high pressure and able to, transmit that very well, so that they're great arteries like the aorta. And they rapidly expand and contract. The source is typically a cerebral artery, but funnily enough, it's most commonly a saccular aneurysm or a Berry acronym aneurysm. L4, L5, L5S1. Hang on, let me think about this. Because hamstrings are on the back, yeah. That's a bad mistake. The retropubic space, 2 to 4 centimeters. greater and lesser left splangic nerves, as well as the hemiazygous vein. How much charge do I have? I have 16%. Okay. This is the maxillary sinus, drains to the middle meatus. So you can kind of see like I have like the same cards over and over and over again, and that's just because like I kind of like it that way because I kind of see it in different contexts. Please be the popliteal surface. Good. The jejunium, the wall's thicker, more high vascularity, longer vasa recta, but less fat, no Peyer's pouches, well, lesser, pardon me, I shouldn't have said no, but that's not a dominant feature. Biliary colic, characterized by pain in the epigastric region that shifts to the right hypoglycemic. Yeah. Because we have our gallstones and they kind of get stuck in the cystic duct, and oh no, that hurts. Parosteal and meningeal layer, and they're continuous at the what? Foramen magnum. Okay. Again, I'm getting fried by that. No tunica media. Tunica media. Is that the spinosum? Yep. Foramen magnum is vertebral arteries, meninges, and the medulla technically. Trunks of the brachial plexus, I think. That might be wrong. Spinal accessory nerve. Cerebral arteries. I have another card that goes into this more in depth. Posterior ethmoid arteries. Small vowel has valvular connivence. Yeah, we have the 3-6-9 rule in play. 3 and 6 for the small vowel. Yeah. 3. For the cecum. Okay, I'll redo that. Sorry. I'm kind of getting exposed tonight, but that's not too bad. That is the subclavian triangle. That is the coracoid process. That is the extraperitoneal fat. That is the because the inferior thyroid artery goes into the brachiocephalic, so the superior and middle thyroid arteries will go into the internal jugular vein. As the midgut elongates, it forms. This is where it goes into the umbilical cord. Yeah. Receive blood under high cardiac output and high pressure. Superior and inferior epigastric artery and vein. That's the vertex. That's the highest point of the cranium. That could be the prosteum, but it could also just be like blood supply and nerves. Yeah. Because it has the prosteum down here, but we know what the prosteum is anyway. Superior border or superior margin. Yeah, this is an odd one. I'm pretty sure this says inferior border and this says superior margin. Yeah, inferior border, superior margin. So I kind of use them interchangeably when I do these cards, unfortunately. Postsynaptic neurons are near the bladder wall. Great. Tightly adheres to the surface of the brain. Yep. These are outdated. But C8 is adductor policies. But they're very outdated because like you can literally see these cuts are way better. Great toe extensions L5. Function. Obviously, the muscles taste. Yeah, that's fine. Facial movement, taste, and parasympathetic nerves. Yeah, I'm okay with that. That's the sternal and the clavicular heads of the sternocleidomastoid. That is the glenohumeral. That is the ligament. That is long limb articulates with the stapes. Diagnosis of a pneumothorax. In what context? The hyperresonant percussion nerve. Everything exits above C, but then C8. So going top to bottom, they will exit above, and then C8 exits below C7, and then the rest essentially follow. Yeah, and yeah, everything else is below the corresponding vertebra. Great. Did I get this wrong earlier? I think I did. Otherwise, it wouldn't be here. This is the midline of the neck. A subdural hemorrhage is typically from a bridging vein related to like the superior sagittal sinus, for example. Again, I've completely not seen that this was like the next card. But yeah, the subdural was between the dura and the arachnoid, but I'll redo that. Superior thyroid, that was a bit embarrassing. Condensation of cells in the dorsal mesogastrium. Inferior thyroid artery from the... Where does the inferior thyroid artery come from? I know it's like really obvious, and I'm going to get really mad with myself, disappointed with myself. Where does the inferior thyroid artery come from? I've said this like so many times as well. Thyrocervical trunk. Yeah, I was never going to get that. I had to see it. We saw this earlier. We already kind of described this one earlier. We know that the anterior root is motor, posterior root is sensory, and then they meet and we have a mixed spinal nerve, and we have our anterior ramus and our posterior ramus. But what I didn't mention is that the posterior ramus supplies like the erector spinae, and the supplies like sensation for the skin of the back, whereas the anterior root well, I guess ventral is anterior and dorsal would be the posterior ramus in that case. It is the anterior lateral limb plexuses, anterior lateral trunk plus limb plexuses. Okay, so I kind of combined the two for ventral ramus. Again, I keep getting hit on that. That's the hypoglossal canal with the hypoglossal nerve. Lymphatic blind. They don't have valves. Yeah. Pharyngotympanic tube. Needle directed inferior to the rib at like an infrasternal angle. If infrasternal means like pointing upwards, then yeah. Yep. Inferior thoracic aperture. That's just the ring from your xiphoid process. Your costal cartilage of ribs 7 to 10, ribs 11 to 12, and then T12, because T12 will be the corresponding vertebrae. Yeah, nice. I got this wrong last time. L5S1. Superior gluteal nerve. That's going to be the inferior. The gluteus medius and minimus, and the tensor fascia lata. How much charge do I have? 13%. Posterior wall of the trachea is membranous. Allows it to move when swallowing. Femoral canal, which is empty, and then the inguinal ligament. That's fine. Maintain steady flow despite changes in pressure. Olfactory nerve, olfactory bulb, olfactory tract, and then I guess it goes to the piriform cortex, but it's going to say something else. Temporal lobe. That's a bit annoying. Orbital plate of frontal bone. That's just hemorrhage. Yeah. Levator. I can't pronounce it even if I wanted to, and I'm trying to pronounce something I can't never learn to pronounce. Levator. Palpebrae. Levator palpebrae. All right, we'll go from the start. Superior rectus, inferior oblique, medial rectus. The pupil constriction, and then levator palpebrae. And it's the wrong card. Oh my gosh. I have a really bad habit of that. Parosteal and meningeal, continuous at the foramen magnum. Vagus is annoying me. Aortic arch and carotid sinus, which is the vagus nerve and the glossopharyngeal nerve. Fair enough. That's the gastric surface. Liver, duodenum. Ascending colon. See, why don't I have that here? Like, I just have viscera. Like, why don't I have aortic arch? Yeah, like, why don't I have that? Anyway. No internal urethral sphincter. Within lingual, no, hang on. Between the genioglossus and the mandible. Because it's like if you lift your tongue up, it's like there. Let's do a little triangle. Lobar bronchial. Small bowel is 30 centimeters. Well, that makes sense because like the yeah, everything added up is about 30. It's 25, then 2.5, then 3.5. So we had the valvular convents, as previously mentioned. Yeah. Spinal accessory nerve. Tidus interna is the labyrinth. So the cochlea, the vestibule, and the semicircular canals. Occurs in the ampulla, acromenon. Is it mandible or is it midline? It's mandible. Yeah, this was midline. No, this was midline. Yeah, so mandible. Creates a U shape that goes into the umbilical cord. Here, L1, neck of pancreas. The floor of the orbit is orbital process of maxilla? Orbital surface of maxilla. Okay. Rapid or shortness of breath plus hyperresonant percussion note. Is this the pelvic kidney? Yeah, a pelvic kidney is one that doesn't ascend, and then you can have a kidney doesn't rotate properly. Yeah. Anterior fossa is what do you call it? Just hemorrhage, epistaxis. Costal parietal parietal. This is wait, hang on. What's costal? There was never any costal. What's this? This was costal. That's diaphragmatic. Okay. Cremasteric fascia. Yep. Joint capsule. Articular capsule. My computer's going to run out of charge soon. I'll ride this out for a bit. Mature blastocyst approaching the uterine wall in like 6 days. Yeah. Inferior thyroid artery from thyrocervical trunk. I know that one. That's so annoying. I've said that like in person. We know the pancreas has endocrine and exocrine functions. Averters. We had the anterior and posterior cruciate ligament. That is the mediastinal part. Phrenic nerve. I think knowing the phrenic nerve is enough, but we do have our intercostals and subcostals as well on the peripheral. So intercostal, I think, is T5 to T11 and subcostal T12. Yep. Again, I have a bad habit of saying things that the card's not even asking for. So this is the potential space between the dura and the arachnoid martyrs. And it's like, I think it's like the walnut one that they said. The tectum, the tegmentium, and this is the spinal cord. The base, my bad. Branch of the brachial plexus, the bladder, falx cerebri, how do you pronounce it? Lumbricals, dorsals, that's fine. Supraclavicular lymph nodes, prostatic uticles, prostatic ducts. Oopsies. Course is the hypoglossal canal. Makes its way into the tongue, but there's an intermediary that I don't know. Floor of the mouth. Okay, I'm pretty sure I can reason that. So dorsal, we said earlier, was the erector spinae muscles plus the skin, corresponding skin of the back, whereas the ventral was anterior lateral trunk plus limb plexuses. Yeah, so I just combined these two earlier. That's okay. Foramen ovale. Mesoderm is muscles, blood, bone. Yeah. Adult sonicals ends at L1, L2. So you can do L2, L3, or L3, L4. And the conus medullaris. Yeah. This is my extensor digitorum. Extensor, no. This is extensor digitorum, sorry. Extensor indices. L4. Neurogenic bladder, or is it pyelonephritis? Schistocytosis. Well, I'll just say neurogenic bladder, that's okay. This is oblique arytenoid. This is transverse arytenoid. This is posterior. No. Oblique arytenoid, transverse arytenoid, posterior cricoarytenoid. Yeah. And that's my, if you go back, that's my abductor. So this fails first. That's the foot. Inferior belly of omohyoid. Major lymph organs include the thymus. I guess bone marrow technically counts because hematopoiesis and generation of B cells. If this counts the spleen, it genuinely could count the spleen, and I wouldn't be surprised if somehow this also says lymph nodes, even though they're not major lymph node organs. Of course it did. Course, that's going to be the olfactory nerve, the olfactory tract, the olfactory bulb, and the temporal lobe. Other way around. Clinical 3, this can cause ptosis, eye down and out. Preauricular is before the ear. It can drain the anterior lateral part of the face. Yep, that's fine. Pulsus paradoxus and oliguria. Mediastinal pleura. It passes over the aorta to reach the IVC. Yep. The descending part, or the second part, that is where I mentioned this earlier, but the greater duodenal papilla is where the hepatopancreatic ampulla enters. the second part of the duodenum at the sphincter of Oddi. And then I guess you also have the minor duodenal papilla as well. And that's 2 centimeters medial on the alimentary canal. It's also retroperitoneal. I think I gave more than enough information though. Again, Vegas is killing me. Medial is serratus anterior. Yeah. I don't know why I blanked on that one. 6 is the pubic body. Collecting system derived from the uteric plug. The lacrum is only like cartilage. Yeah, nothing really passes through. That's the opening of the seminal vesicle or ejaculatory duct. We had this earlier. This is the transverse arytenoid. That's platysma. This causes the cranial and the caudal. The cranial is on the right, and that is the small intestine, and the caudal is on the left, and that's the long intestine, and these are the cranial and caudal limbs. Yeah. We have the tenatorium cerebelli. Yeah. This is the motor sensory. No. Primary motor. No, they use another term. Somatic motor association area. Great. What are my Anki's processing? The inferior pancreatic duodenal artery, which is a branch of the splenic artery. No, SMA. Oh my gosh. The branches of the SMA is inferior pancreatic, well, firstly it's L1, inferior pancreatic duodenal, ileocolic, right colic, middle colic, and then genital ileal. I know my stuff. I'm just getting it mixed up, which is annoying. I'll be back. I'll be back in like 20 minutes. I'll be back in like 20 minutes-ish. Hello, everyone. Let's keep going with these cards. Sorry, I just wanted to make a hot chocolate. Okay, so I'm going to continue. Shahab, can you... hang on. Can you make it so... I'm sharing my screen, but I don't know where it is. Yeah, I'm just going to do some Anki. I'm going to talk it through though. Anyway, it appears that I can't actually get my screen up because everyone's gone to bed. So guess I'm just going to do an audio study session. Unfortunately, you won't be able to see my screen. So a typical synovial joint includes the ligaments, the joint cavity, the synovial fluid. It also contains the articular cartilage, the nerves and blood vessels, and the thing that it's asked me for, I assume, is going to be the articular capsule containing the synovial membrane and the articular it's containing the synovial membrane. Yeah. T1 is the dorsal interossi. We said this earlier. Vagus nerve, I don't know. The brainstem structure, we have the tectum, we have the tegmentium, then we have the base. This was the image of the bladder and the internal urethral sphincter earlier. So this is asking for the prostatic sinuses and ducts. The course of the olfactory nerve is the olfactory nerve, the olfactory tract, the olfactory bulb, and then the temporal cortex. Other way around, bulb, then tract. Okay, fair enough. I think I made that mistake earlier. Uretic. This is about the uretic bulb. The uretic bulb induces the collection of the collecting duct system. Yeah. The function of the vagus nerve, unfortunately, I haven't conquered that yet. The right lung has two fissures, oblique and horizontal. Inferior sagittal is the inferior border of falx cerebri. The mesenelathon, I don't know how to pronounce that. That's just the midbrain. The temporalis is going to elevate and depress and retract the mandible. Elevate and retract the mandible. Upper motor neuron lesion, we know is going to result in increased muscle tone, like Babinski positive, fasciculations, spasticity, hyperreflexia. Great, I didn't get the clasp knife reflex, but that's okay. Image of the femur. This is going to be the lateral epicondyle. the parasympathetic neurovascular supply of the bladder. So parasympathetic is S2, S4, and that is the pelvic splangic nerves. Yep, great. It's an inferior view of the diaphragm, and it's looking at the left cruce. The divisions of the divisions after exit of the spinal cord. I guess this ties back to what we said earlier, where the dorsal is going to be the erector spinae muscles and the corresponding skin of the back, and the ventral is going to be the anterior lateral trunks plus the limb plexuses. And we know that they're both mixed because they meet each other. I'm happy with that. Pec major is the medial pectoral nerve. The blood supply of a nerve is vasa nervosum. Prostatic part of the urethra is surrounded by the prostate gland, and it's the widest. The somatic cord contains a testicular artery. That is the groove for the superior vena cava. Excellent. Flow order regulation maintains steady, well controls blood flow, irresponsible, regardless of humoral responses or autonomic control. Yeah. That's the styloid process of the skull. Patency just means open or unobstructed. So the context of this card is fallopian obstruction or tubal obstruction is a major loss of infertility and is sometimes associated with prior chlamydia infection. The axillary node groups: lateral, anterior, pectoral, posterior, central, and apical. The internal anal sphincter is involuntary smooth muscle surrounding the superior 2/3 of the anal canal. Then we have the pectineal line that separates the two. Clinical importance. The ear is really throwing me out. Otitis media pain is from 9. That makes sense. Fair enough. The upper part is the left gastric artery, and then the lower part is the right gastric artery from the splenic and the gastroduodenal respectively. But no, I actually got that. Yes, no, actually I did get that. That's good. And then so that's for the lesser curvature. Can I get this done? And then for the greater curvature, we have the left gastroemental and then the right gastroemental. We have the picture of the abdomen, and it's pointing to the transversalis fascia. Great. We have the thyroid anatomy and vascular supply. So the thyroid gland consists of the left and right lobes, the isthmus, and surrounded by fibrous capsule and a loose sheath from pretracheal fascia. The brachioradialis is C6. Great. Medial pterygoid is protrusion and side-to-side movements, and that is the... What nerve is that? Oh, wait, no, all of the mastications are V3. Sorry, no, hang on. Did I get mixed up earlier? No, pterygoid's V3, yeah. Internal jugular vein drains the cervical viscera, or viscera cervica. I think it's cervical viscera. The brain, and the face. That is the stylohyoid muscle. That is the left bronchus. Ankle plantar flexion is S1. Yep, that's actually really important. The lateral is the coracobrachialis, the short-headed biceps brachii. We have an image of the shoulder, and it's asking about the teres major, and that's the lower subscapular nerve. That's C5 to C7. No. Yep. I also happen to miscount. It's not asking about number 5, it's asking about number 6. And number 6 is the subscapularis, and that is the upper and lower subscapular nerve. And that is involved in medial rotation of the arm. Cauda equina is a lumbosacral, not plexus, that's not the right word. Roots from lumbosacral enlargement and conus. Okay. We have the renal fascia. The tail is intraperitoneal, as it's enveloped by the splenic ligament, extensile splenic hilum, anterior to the liver. The reticular dermis contains dense connective tissue, and it contains, what do you call it? Not sweat glands. Just glands, right? Blood vessels, glands, yeah, and hair roots. The lambda is the meeting of the sagittal and lambdoid sutures. The deep inguinal ring. I'm just going to go turn my TV down. Give me a second. This is my chair, just for the record. Sorry, let me just tuck my chair in. The deep inguinal the deep inguinal ring is located midway between the asus and pubic tubercle. Yes, the midpoint of the inguinal canal, and it's an opening in the transversalis fascia. And then the superficial inguinal ring is an opening in the external abdominal aponeurosis. The function of the optic nerve is just a special sense of sight. Hip abduction, is adduction is L2 to L4, but abduction is L5S1. This is talking about the development of the embryoblast and the trophoblast. So we know that when the blastocyst cavity expands, the inner cell mass is going to become the embryoblast, and the outer cell mass is going to become the trophoblast. And then we're going to have our division. So the embryoblast is going to become the epi and the hypoblast going inwards, and then the trophoblast is going to become the syncytotrophoblast and the cytotrophoblast going again out to in. Spongy bone is strong because of arrangements along lines of stress, usually found at the ends of bones and on the inner surface. Let's get this done. This is not good. How many cards do I have left? Oh, it's not bad. Okay, let's try to do these cards. So uteric colic. So if you have like calcifications, that can potentially get caught in the ureters. That can increase intraluminal pressure, and that can result in colicky pain. Diaphragmatic parietal pleura. Temporalis is going to elevate and retract the mandible. The contents of the cavernous sinus are going to be 346 internal carotid artery. Yep. Target space for LP is going to be the lumbar cistern within the conus medullaris. Oh, my bad. I should really do that card again. We know what the left coronary artery does, the left atrium, most of the left ventricle, a portion of the right ventricle, the interior 2/3 of the interior of the intraventricular septum. Yeah. Lower lobe. Somatic, superficial inguinal wings, trigone, organomegaly is big. Paranephric fat is outermost. Stratum spinosum. Jugular omohyoid, that's the tongue. Superficial lymphatics follow veins, but deep lymphatics follow arteries. Jugular foramen is going to be 9, 10, 11 with respect to nerves being damaged. Shoulder adduction is going to be C6 to C8. Skeletal has myofibrils. They can be very long, and they're striated with multiple nuclei. They have endomysium, perimysium, and epimysium. Yeah, I said striations. Great. Again, vagus nerve is killing me. Synapses are communication junctions between neurons. The sternocleidomastoid and the targets of the accessory nerve are the sternocleidomastoid and the trapezius. Hip flexion is L2 to L3. The development of the liver or gallbladder, the stalk, there's something about a stalk that becomes the bile duct. Yeah, the stalk of the hepatic diverticulum becomes the bile duct. The superior sagittal sinus continues as the right transverse sinus, but the left goes as the straight sinus, and then the left transverse sinus, and then both of the sinuses become sigmoid sinuses, and then go to the internal jugular veins. Once the sperm gets into the egg, fusion of sperm and oocyte plasma membrane. Again, the vagus nerve is completely frying me. Disappointing. What passes through the aortic hiatus? We're going to have the aorta, or descending aorta, the azygous vein, and the thoracic duct. The maxillary nerve passes through the foramen rotundum. The left main bronchus is longer, passes under, well, it's more oblique, narrower and longer, passes under the arc of the aorta and is anterior to the esophagus. Obstructive jaundice, you just have a intra-extrahepatic blockage of the bile duct that results in bile accumulating in the biliary system, eventually accumulating into the bloodstream, and that results in jaundice. Abduction, so supraspinatus from 0 to 15, deltoid 15 to 90, and then serratus anterior 90 onwards. The incus articulates with the oval yeah, that's fair. The right pleural sac goes from the right sternoclavicular to the sternal angle to the fourth costal cartilage to being posterior to the xiphostomal joint, then sweeps laterally to the 8th rib in the midclavicular line, then 10th rib in the mid-axillary, and then 12th rib in the vertebral. I don't know why I'm getting all this embryology. Cauda equina is lumbosacral enlargement, roots from lumbosacral enlargement. The cranial part of the parasympathetic division of the autonomic system is 3, 7, 9, and 10 cranial nerves. Right. The course, let's get this right, please. Bulb, then tract, then temporal lobe. Great. Regulation of the nervous system with respect to changes in blood flow. I assume it's controlled by baroreceptors, and they transmit signals to the medulla oblongata. Contents of the occipital triangle. We have the spinal accessory nerve with the trunks of the brachial plexus. We have the cervical lymph nodes. And then we're also going to have the superior part, the external carotid artery, external jugular vein. Okay, I just got that mixed up. The glossopharyngeal. This is the one that passes through the ear, through the otitic ganglion. So firstly, we know that 9 is going to pass through the internal acoustic meatus. And then beyond that, no, 9 is jugular foramen. 8 is internal acoustic meatus. I'm getting my nerves mixed up. What does ring? That's fine. Thank you for Shahab for fixing up the stream. Ligaments, joint cavity, synovial fluid, articular capsule. Articular cartilage. Somites give rise to the skeleton. Nutcracker syndrome. So the left renal vein technically runs underneath the superior mesenteric artery. And so if the superior mesenteric artery is enlarged for any particular reason, it can potentially compress the left renal vein, hence nutcracker. This is lateral cricoarytenoid. Yep. This is the broad ligament. Pneumothorax is just air. I guess all fluid in the pleural cavity. Oh, air specifically. This causes the dorsal mesogastrium to pull to the left, eventually forming the greater omentum. This is interlobar vein. Yeah, I think we know what this one does. The well, this is transient. This is, yeah. Okay. Sphincter urethrae. Leptomeninges is a combination of the PR and arachnoid mater. So meningitis involves inflammation of the leptomeninges, involved with photophobia, neck stiffness, rash and fever. No, fever and headache. Okay. Prelaryngeal is the superior deep cervical nodes. Clinical glossopharyngeal. I think we've already kind of covered a lot of it. You lose your gag reflex because you can't swallow, and dry mouth because no parotids. This is the round ligament of the uterus. The course. They will pass through the superior orbital fissure. Yeah, okay. The carotid sheath includes the common carotid, the internal jugular vein, and the vagus nerve. Yeah, like there's many different variations in like segmental arteries, for example. And like, yeah. Anterior is the pec major, the subclavius. Is there one more? Don't be like something dumb like pec minor. It is pec minor. Yeah, that's fine. Oblique, circular, longitudinal. This is the cortical radiate vein. Synapses are essentially your gap junctions or your communicating junctions. These muscular arteries are important for regulating the blood that gets to the organs. Contralateral facial weakness. Ipsilateral. I got mixed up with this. Damn, that sucks. That's okay. That's okay. The subarachnoid space within the lumbar cistern, below the conus medullaris, contains serous fluid that lubricates everything. That's the aconeus. That is the. This is the surface. Base of the heart. Yeah. It's technically talking about behind. The superior sagittal sinus is the superior border of the falx cerebri. This is zygomatic. This is rostrum. So circulation is formed by the contraction of the teniae coli. Spinous processes are like long, slanted, posterior, inferior. Surface marking is on the anterior border of the latissimus dorsi. Shoulder internal rotation is C6 and C7. Okay. Targets. I'm gonna get this vagus eventually. I'm going to assume flexicarpi radialis, and that is the median nerve, and that is adduction and flexion. Nice. This will be a number of things. I'm going to assume that's my lamina. Great. I love this. Some say marry money, but my brother says big. I'm not going to say it on stream. Big bees matter more. So, sensory, mixed. No. Wow, I'm wrong. Sensory, motor, B. Hang on. Some say marry money, but my motor. Yeah, I got to I'm doing it in my head. I'm like, B, what does, if M's mixed, because obviously a mixed spinal nerve, but yeah, a bit silly of me. That's all right. That'll come useful for the exam. We'll get there eventually. Medial is going to be the maxilla and the frontal bone. Posterior auricular is posterior to the ear. It's going to drain the posterior scalp. Yeah. Blood on a hematuria on a dipstick is indicative of utericolic. Anterior lateral boundary, that's just all the muscles until you get to the abdomen. What part of the tongue? I always miss the tongue. Anterior portion. You can't feel the interior tip. 1/3 of the tongue. Anterior tongue. Fair enough. Arise from subclavian arteries. You have epiblast cells that migrate through the primitive node, right? No, primitive streak, because the primitive node makes the nodal cord. Migrate through the primitive streak. The ones that stay, well, they're the epiblast, and they're going to make the ectoderm. But you also have cells that can form the mesoderm and then the endoderm, depending on how deep they actually get. That's during gastrulation. I assume this is the flexor pollicis longus. That's the median nerve. And then that's flexor pollicis longus. Flexor digitorum profundus has the ulnar and the median nerve. This is the opening of the mitral, opening of the aortic valve. I'll redo that. Thoracic duct. Course, we'll get back to that later. Clavaria is frontal temporal parietal. Frontal occipital parietal. We'll do that again. Again, vagus nerve, I don't know. Neuroendocrine hormones from the hypothalamus to the anterior to pituitary gland. Yeah, there's a lot of things that can go wrong with spina bifida. I'm starting to lose my steam. This is annoying. I'm running out of puff. Intertubercular groove. The canal is always longer than the cord. Didn't we have this earlier? Yeah, external part, superior part of the external jugular vein. We have the membranous, which is the narrowest and the least dilatable. That's surrounded by the external urethral sphincter. Yep. The ampulla of the seminal vesicle and the vas deferens. Yep. That is the navicular. I can do 10 months for that. Thick tunica media. Oh no. No, it's not good. Sigmoid, S-shaped tract to the jugular foramen. AV valve closes, aortic opens, aortic closes. No. Yeah, AV valve opens. Yeah. Coronoid process. This is Bell's palsy. So it's ipsilateral if it's upper. It's contralateral if it's lower. Other way around. It is contralateral if it's upper. It's ipsilateral if it's lower. Okay. The mesonephros is a transient and largely regresses. Lumbar sacral. 346 V1. That could be any, yeah. Yes, posterior lateral is most common. Continuous with the parietal of the hilum of the lung. There's 10 per lung. Smallest independent part. Sternohyoid and sternothyroid muscles, right? Spongy goes through the corpus spongiosum and bulbourethral glands open into it. Air in the pleural space. Mid-axillary line is the midpoint between the anterior and posterior axillary fold. That is thyroepiglottic ligament. Yep. On the pec major, flared part of the diaphysis closer to the epiphysis. Oh, I'm getting tired. I'm slowing down. The retromammary space lies between the pec major and minor, allowing the breast. Oh, hang on. No. Oopsie doopsie. That is my sternocleidomastoid. That's the spinal accessory nerve plus C2, C3. That allows me to twist my head not every which way, but most ways. It's a levator scapulae. That's okay. Levator scapulae is C3, C4, and the dorsal scapular nerve. Let's make a note of that. Quarter equina is root enlargement of enlargement of lumbosacral roots, protection, sensation. The genital branch of the genital femoral nerve that gives rise to the cremasteric nerve. What? They protrude through Hasselbalch's triangle. Silly. Trapezium. L5. Segmental artery. Somatostatin, which interferes with both of them. Hypotension. Rigid borders. Facial nerve. Ryan's test is AC should be greater than Air conduction should be greater than bone conduction. If bone conduction is greater than air conduction, then it's a conductive issue. If air conduction is greater than bone conduction, but there's less noise overall, then it's a sensorineural issue. Nice. Associated with that ER, obviously, because Ryan's test is, ipsilateral facial weakness. Great. Obturator foramen. Anterior border of sternocleidomastoid. C6, C7. No function, no true anastomosis. This could be anything, like forms a connection between the tympanic membrane and the oval window. Oh, like literally that. That's literally what I was asking. Fair enough. I have 6%. The popliteus is the, I think it's the sciatic nerve. It's a tibial. My bad. It's low enough to be a tibial nerve. The that's actually a bad mistake. Popliteus is, yeah. I'm gonna try again on that one. The interatrial septum separates the left and right atrium. Good job. The costomediastinal recess is the, well, it's where the heart is, but it's more, the right side's more unprotected, yeah. And larger on the left side, that's where the heart actually sits. That's the chromosteric, orbital openings, the optic canals at the apex. Rule of 4, 4 from the medulla, 4 from the pons, 4 from the midbrain. No, 4. Okay, I got to fix this card. Because why is it out of order? Actually, why is that such out of order? That's annoying. Okay. All right, there we go. That's better. 4 above the pons, 4 in the pons, 4 in the medulla. So where do 1, 2, 3, 4 come from? Yeah. Hyporeflexia, atonic, like atonic, like no muscle tone. Negative Babinski, atrophy, no reflexes, loss of voluntary movements. The head's related to the angle of the mandible, and the base is related to the zygomatic arch. That's the just anterior superior surface. What's the sequence? I'm really slowing down. Savanagonia, primary spermatocyte, spermatids, spermatozoa. Nice, I got it. Opening of aortic valve. I assume this is talking about the superior mesenteric vein and the splenic vein was joined to form the hepatic portal vein. Yeah. Inferior to the ampulla of the vas deferens. Anterior. Okay, we'll read it up. Flexor digitorum profundus. This flexes the dip of your phalanges, and that is the median and ulnar nerve. Clavaria, frontal, temporal, frontal parietal occipital. Okay. Frontal parietal occipital. Okay. Accessory along. So we have the anterior longitudinal ligament, posterior longitudinal ligament, supraspinous, interspinous, ligamentum flavum. Is there anything I'm missing? Neutral. I don't care about neutral. What could this be in reference to? I assume that's lateral rectus. Lateral rectus is the abducens. Yeah. Occipital is the muscles of the neck. Yeah. Completion of second mitotic division, inflammation of the female pronucleus. Inferior petrosal sinus, facial and lingual veins, pharyngeal veins, and the superior and middle thyroid. We'll skip that. Flagellin is a tough filament-like protein that helps keep everything in place. Helps hold together my epithelium. This is duodenal compression and obstruction. Yeah. That is reticulonacular artery is great. That is dorsals, and that's the ulnar nerve. That's C5, C6. That is transversalis fascia. They're supplied by tertiary branches of my pulmonary arteries. Tertiary bronchus, oopsies. Herniation of abdominal contents into the womb, I suppose, into the amniotic cavity, right? Carina found at the T4, T5 sternal angle, marks point of the tracheal bifurcation. Only 5%. How long have I been going for? Been going for a while. Pretty happy. I'm going to go until these are done. Actually, I want to see my timing. Yeah, 8 seconds. That's a bit much. I'm usually a lot quicker, but I'm slow. You know how much anatomy cards I had today? I had 1,000 anatomy cards alone. And I was like, oh. So the fact I got it down to here is amazing. Yeah, I'm fine with that. So ipsilateral is lower, contralateral is upper. Again, Vegas, I will conquer you one day. Start with a marula, a 16 to 32 cell ball. Blastocyst cavity is now the primitive yolk sat. I'm okay with that. Again, I'll get you one day. Ethmoid communicates with the maxillary sinus, so it's a common route for tumor spread. 1, 2, 3. This is the levator scapulae. That's dorsal scapular nerve plus C3, C4. This is the retromammary space, but I can't remember what it lies between. Pectoral fascia and the breast, allowing the breast to actually move over the pec major. That is the hepatopancreatic ampulla. We already kind of established this one. This is like a bridging vein in like relation to like the superior sagittal sinus, typical from like trauma due to falls, walnut shaped, This is in the potential space between the dura and the arachnoid martyrs. And it's slower because obviously it's venous. Located, parallel along the sternum. Lymphatic vessels contain, they do contain valves, my bad. Often associated with chromosomal anomalies, yeah. Skin, actually, let's do this. So skin, subcutaneous tissue, supraspinous, interspinous, dura, no. What am I getting mixed up? Ligamentum flavum, dura, and subarachnoid space. Yeah. Epidural space. Dura, subarachnoid space. Okay. Yeah, I'm okay with that. For the epidural anesthesia, again, that's a true space. Is it? Yes, that is a true space. So you want to inject it into, into that true space around the corresponding sacral nerves. Yeah. That's a transverse humeral ligament, parasternal. That's fine. Okay, so we've seen this card so many times tonight. Yeah, that's fine. Do not pass through the deep inguinal ring. Anterior bedi of digastric antrum. Superior, is it costal or articular facet? Costal facet. That's the articular facet. Okay, yeah. The bregma is where the sagittal and coronal sutures meet. The liver developing in the ventral mesogastrium shifts to the right. The pancreas developing in the dorsal mesogastrium shifts to the left. The head of the pancreas, initially intraperitoneal, becomes retroperitoneal as the peritoneum fuses with the posterior abdominal wall. Popliteus is the tibial nerve. That was a bad mistake. Carotid triangle is, how many cards do I have left? 110. That's not bad. Hey, I finally came first. Not bad. Okay, I just gotta finish these cards. Then I can go to sleep. Carotid triangle is going to be the superior belly of the omohyoid, drained by pulmonary veins. That's the cramosteric, spermatic fascia. Tubular structures where they secrete into retromandibular vein. I think we've said this multiple times tonight. The hair root contains a cell matrix. That's fine. Ligaments are reinforced by the corresponding muscles. Yeah, muscles. Oh, I wonder what this is. Internal carotid artery. Diffuse haziness. Yeah. Calcaneus. That could be the splenic flexure. Yeah. This is the horseshoe where they're fused together at their on their lower poles. Arrested by the inferior mesenteric. Excuse me, I'm actually tired. So this is the labyrinth. So this is the semicircular canals, the vestibule, and the cochlea, and the membranous labyrinth. So this is vein, artery, and then pelvis, anterior to posterior. Neurotransmitters. This one's always a bit odd. But I'm okay with that. So all pre-release acetylcholine, para post secrete acetylcholine. Simpa post release noradrenaline, except so essentially everything is acetylcholine except for postganglionic sympathetic, but even they do it, so that's okay. Well, this is actually the minimus, but I know it's going to say this is mismatched, so this is minimus, but this is going to say medius, and this is going to say superior gluteal nerve. Yeah, but it's just the wrong card. Yeah, we'll get back to that. I think we're okay with that by now. Same with that. Orbicularis oci, liver. Yeah, actually, I remember this from my ultrasound workshop that I had. That was a lot of fun for EFAST scanning. Anterior to the ductus deferens. No, posterior to the ductus deferens and anterior to the seminal vesicle. Yep. Here goes conus medullaris, quarter equina, and then foramen terminal. Other way around. That's okay. Yep, that's fine. Actually, I'm going to go back to this one. We know that obviously that's released by the ovary. I know that that's the superior border of the scapula. I know that's the sacrum. I know that this is the stenoc. No, I didn't actually know that. The neck of the femur is vulnerable to avascular necrosis because it's commonly fractured because it's very weak. That's fine. Yeah, we've spoken about that. Closure of mitral valve, great. Is this the nerves? Vestibulocochlear. This is the paralymph and endolymph. Body lies in epitympanic space. Overlies two distinct territories. Medial malleolus. We can have the ethmoid sinus. So anterior and middle both go to middle meatus, but posterior goes to superior meatus. Great. This is T1 to L2 of the lateral horn. Obviously, feet have like thicker skin, so they have stratum lucidum compared to like my eyelid. Again, that's two very different examples. But another one's that extensors tend to have thicker skin than flexors. Yeah. Oh, literally, I used eyelids. That's funny. Okay, I think this is where my confusion comes from. So let me adjust this. I'll be back. I'm just going to jump on to good old ChatGPT. I'll be back shortly. It actually wanted me to change the card entirely. So this is a new card. So the midpoint of the inguinal ligament is located halfway between the aces and the pubic-cubical, which we know. It corresponds to the surface landmark for right, that makes sense. Okay, so I'm going to move this down. Yes. That makes great sense. Yes. So the midpoint of the inguinal ligament is where the deep inguinal ring is, which is obviously where the I'm gonna grab my charger back. But that's where the deep inguinal ring is, and that's where the deep inguinal ring is, and that's where the inguinal ligament starts, and that's where indirect hernias can begin by entering in the deep inguinal canal. Yes, I'm actually going to repeat that card, but I will be back in a second. Okay. So lymphatic vessels contain unidirectional valves and rely on things such as like us breathing, our muscle contractions, motion to actually move lymph. Yeah. Frontal, parietal, occipital. Excellent. In the fifth to sixth intercostal space. In the midclavicular line, into the bare area of the pericardium, avoiding the lungs, and the ventricles of the heart. Yeah. We'll conquer you someday. Interlobar. Extension is glute medius and minimus. No. That's okay. This is the neck. I made a little mistake there. 12th hepatic flexure. Don't spiral, please. Submental triangle. I forget what goes here. Sphenoid ethmoid meatus. And that is the sphenoid sinus. Yeah. Falx cerebelli. Tensor tympani. Let's not. By changing calcium channel into cells. That was a dumb multiple choice question in the exam that, like, technically we hadn't done. The perineuron forms part of the blood nerve barrier. That is the pleural cavity. The suprarenal and gonadal. Yeah, before draining into the IVC. Whereas the right drains directly into the IVC. Third part of the subclavian artery. Xiphostomal joint. 3, 4, V1, 6. No. Internal acoustic meatus is 7, 8, and the labyrinth artery. Epiphysis. C5. We know it's going to go from the foramen magnum into foramen magnum into the jugular foramen into the occipital triangle. I don't know. We'll get there. Conus medullaris, filium terminal, and the quarter equina, lumbar sacral roots. Neurons, they're the conductive, excitable cells. They always conduct away from the soma. Herniation into the umbilical cord. Is this facial or is this V3? No, this is V3. Left atrium and ventricle, the subclavian, the arc of the aorta. Is that it? I guess technically brachiocephalic, but I don't think that's what we're asking for. Yeah, I think this is the aorta. Then the nerves is the vagus and phrenic. Bone is the first rib. Ligament is the pulmonary ligament. Tubes are the the left lung, the esophagus and the trachea, because, yeah, and then we know RAS, RALS. So my bronchus is always going to be posterior, and then LS, my pulmonary artery, is going to be superior, so my pulmonary veins are going to be inferior. Great. Pec major and minor. Internal spermatic fascia. Heart rate. Modified chromatin. Triangular. Vertical diplopia. Posterior inferior lateral surface. Facial nerve. Alveolus. Preload. If you want to give that intercostal catheter, you have to go superior to the rib to avoid the neurovascular bundle. Parathyroid glands removed can cause tetany. Oh, come on, Alessandro, you have 44 cards to go. You can do this. Absolutely, you can do this. How many anatomy cards do I have tomorrow? I got a lot of blue link. That's good. Can run through that. And actually, surprisingly, not a lot of anatomy. Interesting. A lot of blue link, which I did this morning. The mesonephric duct can induce the formation of nephron formation. But they have like fate information and like symmetry information. Facial nerve, mostly located in the upper left quadrant. Yeah, thick walls along vessel rectal. Common carotid. Yeah, I think we know where that is. We've only done so much work. Temporal. Esophagus, small esophageal arteries, and anterior posterior vagal trunks. The internal intercostals, external acoustic meatus, potentially the mastoid process, and the auricle. Yep. The middle part of the laryngeal cavity. Beta blockers, calcium blockers, decrease contractility. Rotter's nodes are found between the pec major and minor muscles. That's why I was getting mixed up with the retromammary space. These are my occipital condyles. Yeah, we kind of already know what this one does. So the right atrium, the right ventricle, the posterior 1/3 of the interventricular septum, the AV node and the SA node, dura, arachnoid, and pia, ACES, SA nodal branch. That is the foramen ovale, oval, however you pronounce it. That is V3. Yeah, we kind of bioaccumulation resulting in jaundice. Yep. Yeah, that's where the conus medullaris is. I'm okay with that. That is the extensor digitorum longus, L4, L5, and that's the deep fibular nerve. Yeah, the deep inguinal line. I'm okay with that. So we have the nasal, the ethmoid, the maxillary, and the. Don't do this to me. Don't do this to me. Is that a really obvious one? Frontal. Great. That is the superior thyroid notch. We know that they rise and rotate. Opening a mitral valve. Oh boy, now, I have to deal with the vagus nerve. No! The mandible, that's all right. Glute max. That's just the somatic nerve, yeah. Gallstones are precipitations of bile. They're usually intrahepatic. Yeah. T11 to T10 to T12. Hepatic flexure elevates mandible V3. I'm going to save you to last. Save these three to last. Colossum facial nerve gives quarter tympany. Vertical diplopia, head tilt away. T10 to T12, visceral pain around the umbilicus, filled with perilymph and osmium. We have the tensor tympani, tympanic plexus 9, provides sensory to the middle ear mucosa. Oh, we already know this, yeah, because that's the inside of the tympanic membrane. Preganglionic, secrete acetylcholine onto chromaffin cells. Facial nerve, quarter tympani, interior takes 2/3 of the tongue. Yep. Perilymph and endolymph. No, where's the thing? No, I want other cards. Wait, is this genuinely it? Okay, fair enough. Function, swallowing, parotid gland, taste, and baroreceptor, chemoreceptor. Great. Function of the vagus nerve is pharyngeolaryngeal muscles, and then parasympathetic control, dysphonia, dysphagia, and then ulvar deviation, uvula. I genuinely don't know this. Targets the larynx, laryngeal, and pharyngeal muscles, as well as the thorax and abdomen. Jugular foramen, tympanic branch, lesser, jugular foramen, tympanic branch, otitic ganglion, parotid gland. 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 I think that's happy. Wow. Okay. So, thank you for doing some Anki with me today. I'm gonna get some sleep, and then we'll go again tomorrow. We have all these cards to do tomorrow. Plus, well, you know, may as well just update. We have 2,400 cards left. And then I am officially done. So I'm going to try to do that tomorrow, because obviously I don't know how much time I'm going to have on Friday. I genuinely don't know. And yeah, I'm really starting to slow down. So anyway, thank you for joining me. And Shahab will be on here soon. But as you can see, I did a 4-hour study session, which is definitely a lot. But yeah, thank you for joining. And I hope my voice didn't annoy you too much. I hope my very erratic study strategy didn't annoy you too much. And yeah, I hope you have a good night. Good night.